Hello, everybody. Welcome to today's video lecture, and we're covering the peripheral nervous system. So this is actually the same PowerPoint that the central nervous system is, where the central nervous system is. I cover most of this PowerPoint. I already recorded 3 videos. So I'm just gonna scroll down to the slides that are related to the PNS. So right here. So let's go ahead and begin. So central nervous system is made of brain and spinal cord, and everything else is part of the PNS, or peripheral nervous system. Now that will include your nerves, plexuses, then ganglia, receptors, right? So pretty much everything that is not brain and spinal cord. Now, peripheral nervous system sends information to the central nervous system and receives impulses from the CNS, and then peripheral nervous system and innervate your effector organs. I just want to remind you that effector organs are muscles, including skeletal, smooth, cardiac, and glands. The peripheral nervous system is divided into sensory division and motor division. Now, the word that we use for sensory is afferent and efferent for motor. And you can see that sensory division, it brings information to, to your central nervous system, right? So sensory or afferent division, let's say you have pain receptors in your skin, or you have proprioceptors in your muscles. So that sensory information travels to your spinal cord and your brain. Right? Now, your central nervous system, when it receives sensory information, it will analyze it, make sense of it, and decide what to do about the sensation. And then CNS will send impulses or commands through the peripheral nervous system, specifically through motor division, to your effector organs. Now, motor division is divided into somatic nervous system and autonomic. Now, autonomic, abbreviation for autonomic nervous system is ANS. Now, somatic nervous system, those are nerves that innervate your skeletal muscles, something that you can consciously control. An autonomic nervous system will have nerves that innervate your smooth muscle, cardiac muscles, and glands. And this is involuntary response, something that you will not control. Now, autonomic nervous system further is divided into sympathetic and parasympathetic. Now, sympathetic is what we call fight or flight response. So when you're under stress, and it's not only, like when we hear word stress, we're always thinking about some mental stress that we have plenty in our life, but it's also, for example, when you're exercising, right? When you exercise, that's also considered to be stress on your body, right? So then when you're exercising, or when you're scared, or when you need to run for your life, then the sympathetic division will take control over your autonomic organs. Parasympathetic division we call rest and digest. So when you come, when you're eating, when you're watching your TV, then parasympathetic division control your smooth muscle, cardiac muscles, and your glands. Right. Now let's get some vocabulary. Let's get sense of some vocabulary that we're gonna use. Now, ganglia. Now, ganglia is a bunch of cell bodies and dendrites that are outside of a central nervous system. So if you have, like over here, look, We have lots of neuronal bodies. So that's neuron. This is the body of neuronal soma. And you have a bunch of them in PNS. So we call it ganglia, right? So that's what our definition here is. Neurons with sensory ending in the periphery, and sensory neurons over here, they are unipolar cells. So you can see there is one process coming from the body, and then its branches. So like over here, so it's coming off the body and its branches. So we have peripheral and central process. Now, peripheral process goes towards your periphery, right? Wherever you have your sensory receptors, and a central process will go towards spinal cord. So we have dorsal root ganglion, for example, cranial nerve ganglion. This is your on a picture above. You have spinal cord. Remember, we already covered, we have those roots. So we have anterior root. Those are, by the way, called rootlets. And then we have root. So this is our anterior root. This is our posterior root. And posterior and anterior root gonna make this structure over here that is your spinal nerve, right? So that's a spinal. Oh, by the way, here, I apologize. I show you this one as a peripheral process, but it's actually towards the spinal cord. So that's your central process. So peripheral process goes this way. I apologize because I see spinal nerve over here. So remember, I told you we have it's a unipolar neuron. So we have one process and it divides just this way. This is our peripheral process, and this way, this is our central process. So back to this diagram. So we have anterior root, we have posterior root there, and those roots make your spinal nerves. Now in posterior root, you have the structure called posterior root ganglion. So this is how it looks. And this is where we have cell bodies of sensory neurons, unipolar cells. Now cranial nerve ganglion are not shown over here, but they are associated with cranial nerves. For example, trigeminal ganglion. Cranial nerves, they branch from brain, and spinal nerves branch from spinal cord. Right, so hope it makes sense. Okay, now what happened over here? So if you look at this diagram, you can see a spinal cord, and those are vertebrae, right? So you have C3, C4, C5, right? So those are vertebrae, cervical, and then here's T1, thoracic vertebra. Now then you have this structure coming out through intervertebral foramen. Inter means between. So between two vertebrae, for example, between C3 and C4, or between C4 and C5, we have intervertebral foramen, and we have structure shown here in yellow, coming, leaving the spinal cord, coming through this foramen, and this is our spinal nerves, right? So spinal nerves is actually a pretty short structure, and then it starts branching. So you see how it has, many branches over here, and those are so those are called just a second, for some reason forgot this word. Okay, so anyways, those are called rami. Ramus, I believe, comes from Latin language, right? Oh, yeah, probably from Latin language, means branch. So we have a ventral and dorsal, or anterior and posterior rami. And then the anterior rami, so those are branches, anterior rami, they form the branching network, right, of the nerve fibers, and this network is called plexus. Right, so let's kind of like, and you know what? Let me see if I have the picture right there. So this, let's get to this picture for a second, just so we understand it better. So what we have over here now, this structure is our spinal cord, right? Then this is our ventral root, this is our dorsal root, this is dorsal root ganglion, right, where we have our sensory neurons. And now this structure over here is a spinal nerve, right? So here is the spinal nerve. So it actually exits the vertebral cavity through intervertebral foramen. And then look what happened. It branches almost immediately into dorsal ramus and a bigger ventral ramus. And then we have some other like rami communicants. But this ventral rami, some of them, with exception of T2, L2, but some of these ventral rami, they form plexuses, right? So let's, over here, so here we can see those plexuses. That a plexus is branching network of intersecting nerves. It composed of efferent, that means your sensory, and efferent, your motor fibers that arise from the merging of the anterior rami of the spinal nerves and blood vessels. So those, plexuses, they are formed from anterior rami. We have 4 spinal nerve plexuses, and we have autonomic plexuses. Now, we're going to look at these plexuses in details. It says here, except in the thoracic region. So in the thoracic region, we do not have plexuses. Now, what happened with those anterior and posterior rami in the thoracic region will be covered in this part, right? But so far, we need to understand at this point that from the spinal cord, we have 2 roots that comes together forming spinal nerves, right? And those spinal nerves then branch into posterior and anterior rami, and anterior rami form interlacing network of nerve fibers, and so that network is called plexus, right? And we have it. We have like cervical plexus, brachial plexus, right? Lumbar plexus, sacral, but we do not have plexuses in thoracic region. Right now, what are nerves? We just mentioned we have, spinal nerves, cranial nerves. So nerves are bundles of axons in the peripheral nervous system, and they covered by connective tissue, and there are blood vessels within those bundles. All right, so if you look over here, I kind of show you, spinal nerve, maybe it's peripheral nerve that cover by connective tissue. Now, the ones that cover entire nerve is called epineurium. So it's outer surface. Epi means on the surface, so it's epineurium. Now, then if you look at what's going on inside, right, we have those bundles of nerve fibers. So here's one, here's another one, here's another one, and we call them fascicles. And fascicles are covered by perineurium. And then if you look inside this perineurium, then you will see individual axons, and they are covered by endoneurium. So similar to muscle fibers. Only we have epimysium, perimysium, and endomysium when we're talking about skeletal muscle fibers. When we're talking about axons and fascicles or bundles of axons, then we use neurium. So epineurium, perineurium, and endoneurium. So perineurium surrounds fascicles, and endoneurium surrounds individual axons. Right, so you can see over here the perineurium That means we have a fascicle inside, and then you have fascicles, and within the fascicles you will have individual axons covered by endoneurium. Okay, so we also mentioned that we have cranial nerves and we have spinal nerves. Now we have 12 pairs of cranial nerves, and they all are connected to the central nervous system at the level of brain, right? So they connected to brain. And remember, your midbrain, pons, and medulla, that's part of the brain too. So your brain is not only cerebrum, it's also cerebellum over here, and midbrain, or diencephalon and midbrain, pons and medulla. That is called brain stem. Right, so cranial nerves, interesting about cranial nerves, they can be just a purely sensory nerve. So only sensory information travels through those fibers, or they can be only motor. So only motor commands, or they can be both. We call them mixed. So they might have both sensory and motor fibers. And they have numbers and names. So over here, one is olfactory, then we have optic. Then we have over here oculomotor, so I'm just gonna put like this. Then we have trochlea. Then we have trigeminal, number 5. Number 6, we have abducens. We have a first facial, number 7. Then vestibular cochlear. Then we have, so this is our 8. So our 9 would be glossopharyngeal, vagus, number 10, accessory, and hypoglossal. Right, so that's our 12 pairs of cranial nerves. So if we look in this diagram here, they show you basic functions. So it's a really, really quick introduction. So number 1, olfactory. So that's olfactory means smell. So that's in your nasal cavity. So allow you to smell. So that's a sensory nerve. And by the way, if you look over here, if you have red lines, that means those are sensory fibers. If you have blue, motor fibers. And sometimes, like over here, for example, you have both red and blue. Here, red and blue. That means this is mixed. Right, so olfactory, then we have optic. So that's a vision. So start with your retina, right, and moves to the brain. So that's also only sensory. Number 3 is over here. That is number 3, oculomotor first. Yeah, so right there. Number 3, oculomotor. So it's right there. And oculomotor is motor fibers. So it's innervate intrinsic muscles of the eye and allow you to move your eyes, right? Move your eyeball. So that's our motor. Now, number 4 is trochlea, and trochlea also innervates one of the muscles over here. It's a superior oblique muscle right there. So number 3 and number 4, they both are motor nerves, and they innervate a muscle of your eye. Okay, then we go to number 4. That is right here. Okay, 3, 4 we already covered. 3 is trochlea, and 4 is I'm sorry, 3 is oculomotor and 4 is trochlea. Now, number 5 is our huge nerve right here, and it's called trigeminal. Now, it's called trigeminal because it has 3 branches, right? And trigeminal nerve over here innervate your face, your sinuses, your teeth, and also has some motor function, innervates your muscles of mastication. So sensation from your face, right? Sensation from your face travels to your brain through the trigeminal nerve. Right? and also muscle of mastication, allow you to chew your food. Also innervated by this trigeminal nerve. So over here you can see a blue fiber right there. So we have like a temporalis over here muscle and masseter. Okay, so that was 5. Then we move to 6, and 6 is also, you see over here, also innervates muscle of eye. Right, it's called abducens. I cannot see, where is that over here? Maybe it's covered by, okay, where's my abducens over here? But abducens means abducts, and abduct means taking away, right? So now let me see, where I cannot find abducens. Oh, right there. You know, external rectus muscle over here. So that will be lateral rectus. So 3, 4, and 6, 3, 4, and 6, all these cranial nerves innervate muscle of eyeball. Right, after 6, we have 7. Now 7 is facial. So let me find where my facial is, right there. So here's the facial nerve, and facial, you see, is a motor nerve, and it's innervate muscles of the face and allow you to do facial expression, right? So when you move your skin in your face, right? When you smile, when you frown, you need, obviously, for your muscles to contract, innervation from nerves, and it will be a facial nerve, muscles of the face. Number 8 is over here, I think it's vestibular-cochlear nerve. So it's shown right there. So that's a vestibular-cochlear. Now, vestibule and cochlear, those are structures that found in your inner ear, right? So that means it brings information, auditory information, so you can hear, that's a cochlea, and your balance and equilibrium comes from the vestibular part, and they make this nerve vestibular cochlear nerve. Okay, next we have number 9, and number 9 is a glossopharyngeal, so that's right here. Now this one is mixed, so it's shown right there, 9. So it has sensory and motor fibers. So it's a pharyngeal musculature, and pharynx is your throat, and sensory information, posterior part of tongue, tonsils, and pharynx. So that's a sensory information comes through this nerve, right? That's a glossopharyngeal. Glossa means tongue, and pharyngeal means your pharynx or throat. So it's innervate your tongue and your throat. Now 10, here's this pretty, you know, important nerve. It's a major parasympathetic nerve, vagus, and this is the only nerve that moves beyond your cervical region. So this one is actually goes all the way down to your thoracic and abdominal cavity, and it's innervate most of the viscera of your abdominal cavity. So you can see heart, lungs, bronchi, gastrointestinal tract. So that's our motor branches. And it also brings sensory information from heart, lungs, bronchi, trachea, larynx, pharynx, gastrointestinal tract, and plus internal ear. So all sensory and motor information travels to your internal organ, to your viscera through vagus, and vagus is parasympathetic. That means that your all these organs shown over here controlled by vagus nerve when you rest and digest. Now 11 is a motor, and it's called accessory, and it's innervates only 2 muscles of the neck, sternocleidomastoid and trapezius muscle. And then 12, 12 right here, and it's hypoglossal. So again, glossal means tongue, hyper means below the tongue, and this one, movement of your tongue. So that's a motor nerve. Right, so yeah, I know it's a lot here really to memorize, and you would even ask like, how are I even supposed to memorize this stuff? But when we have our lab, we're gonna draw a picture, like mnemonic picture, that hopefully will help you to memorize those nerves a little bit better. Right? Okay. Oops. So anyway, I kind of cover this diagram a little bit, right? But we're gonna talk about spinal nerves. And as I already said, you have spinal cord that is a part of CNS, central nervous systems, and we have roots. We have ventral dorsal root, and those roots then form your spinal nerve, and then it branches into rami. So we have ventral ramus and dorsal ramus, and ventral ramus is a larger ramus. So here, each spinal nerve branches into mixed rami, dorsal ramus and larger ventral ramus, and rami communicants are right here, and those are part of autonomic nervous system. You see, it's connected to the sympathetic trunk. Now, mixed means they're gonna carry both sensory and motor information. All spinal nerves are mixed nerves. So when we look at our cranial nerves over here, you see it says they can be sensory or motor or both, right? But all the spinal nerves are both, so they are mixed. That means you will have both sensory and motor fibers, right? Now, let's see what happened next, right? So here we have our spinal nerve. And again, that's pretty short structure right there. Here we have our dorsal ramus, and this is our ventral ramus. Now, you can see the dorsal ramus, because this is anterior over here. This is anterior and this is posterior. So dorsal ramus innervates muscles and skin, right, of your back. So the back is innervated by dorsal rami via several branches. Now ventral rami, so those are ventral rami over here, from T2 to T12, right? Did I say? I think I said something incorrect before. I think T2 till what, L2? No, I'm sorry, I apologize. From T2 to T12, those ventral rami are not forming any plexuses. So let me go back. And I'm just gonna correct myself. So remember when I told you about these plexuses, that means that when we have our ventral rami, now ventral rami form those plexuses. So it's intersecting nerve fibers, right? So let's see, like, is these fibers and these fibers and these fibers, they all come together, they all intersect, forming this plexus. And I think I told you T2, L2, that's my bad, from T2, right? Let me get not vanishing pen because it's, okay, so I'm gonna write it here. From T2 till T12, no plexus, right? No plexus. Now, what is T2 and T12? Well, you have vertebra, right? So here's your vertebra. Here's another vertebra. Right? This is another vertebra. And let's say you have 7 cervicals. So let's say this is C7, right? And then this is your T1, right? So these nerves coming below this T1, this is, our first spinal nerve, right? And then this is our T2, and this is our vertebra T3. So now start from here, from T2 all the way down to T12. Those nerves, they do not form plexuses. That makes sense? So I apologize. I think I gave you a little bit incorrect information before. So, oh, okay, let me go back. I guess I need to clear all drawings. So hopefully you guys get it this time, right? Okay, anyway, so all this T2 or let me get my finishing pen now, T2, T12, they became nerves that we call intercostal nerves. So you can see over here, right? So look, it goes right there and it gives some branches, right? So several branches. So you have branch over here, you have branch over there, you have branches here. Intercostal means between ribs, right? So they became intercostal nerves. And what they do, they supply muscles of the ribs, anterior lateral thorax, and abdominal wall. And remember, all of them are mixed. So they also supply skin around this area. Now, all ventral rami except this T2, T12 form interlacing nerve networks called plexuses, and we have cervical, brachial, lumbar, and sacral plexuses. And if you can see over here, like brachial, lumbar, and sacral, and cervical, well, let's say brachial, lumbar, and sacral, these three plexuses, they will form nerves that innervate your upper and lower limbs. And cervical, we will look at it, but that will innervate, you know, it will go to your neck and partially to your head and neck, and it innervates, you know, your cervical and region and your head. So let's say, continue with our spinal nerves, right? So you can see C1, C2 right there, C3, C4, C5. Now all these nerves gonna form cervical plexus. Then C5, sometimes I include C5 over here, C6, C7, C8, and T1. Those gonna form this plexus that is brachial. So here's our cervical plexus. This is our brachial plexus. Now you see no plexuses over here from T2 till T12, and then L1, L2, L3, L4, L5. They're gonna do our lumbar plexus, and then from S1, S2, S3, S4, S5, we will have our sacral plexus, right? So systemic nerves, this is very important over here. So for example, let's look at this brachial plexus over here. Now we have brachial plexus and nerves come from C5, C6, C7, C8, T1, and then they form our systemic or peripheral nerves like ulnar nerve or radial nerve or axillary nerve. And those nerves, ulnar and radial, for example, they will go to your arm. So that's our peripheral or systemic nerve. So they carry axons or fibers from different spinal nerves. So ulnar nerve, it's not your like T1 or C8. This has fibers from a different spinal nerves. That makes sense? So spinal nerves connected to spinal cord, we have 31 pairs, obviously not 31 total, but 31 pairs. They all mixed. That means they carry sensory and motor, and they're named for the level at which they emerge, right? So we have C1 to C8, T1 to T12, L1, L5, S1, S5. And they extend outward from vertebral column and innervate periphery, right? Okay. Hopefully it makes sense. So now let's look at this plexuses, and plus we're gonna look only at few nerves that are, that we will try to remember. So here's our what's shown our rami. So I guess, so this is our C1, C2, C3, C4, and sometimes it includes C5. Even they say that cervical plexus C1, C4, right? But you see how we have, like, this is our C1. It's actually, it's not a nerve. In some books you call it C1 nerve, but it's already ventral ramus, ventral ramus, right? Because here's our dorsal ramus, and this is our ventral ramus. And then you see what's going on over here. We have all these fibers mixed with each other, and then they form our peripheral nerves. So formed by ventral rami, C1, C4, innervate skin and muscles of the neck, ear, back of the head, and shoulder. And the nerve that we want to remember is phrenic nerve. Now, phrenic nerve includes fibers from C5. That's why we sometimes include C5 in the cervical plexus. So phrenic nerve, C3, C5, and it's a major motor and sensory nerve of the diaphragm, right? And diaphragm is important in breathing, so it's a very important nerve. That means if we have damage right here or right here or right here, any of these damages can affect phrenic nerve. So in cervical plexus, we want to remember phrenic nerve. Brachial plexus. Brachial plexus is very complex. So this is from C5 to C8 and T1. And again, even C2, T2 fibers sometimes very often part of this plexus. The brachial plexus gives rise to the nerves that innervate the upper limb. And there is a division over here, major branches of this plexus. So here we have our rami, right? So we have ventral rami, then a ventral rami from C5, right, to T1. Then a rami form 3 trunks. So here over here, the trunks. So we have upper, middle, and lower trunk. Then those trunks form divisions, and we have over here posterior division shown in red, and we have lateral division, and okay, so we have, yeah, but no, that's a cords, lateral, posterior, and medial. So we only have posterior division over here and anterior division, yes. So the red ones, we have a posterior division, and what's shown in white, we have anterior division. Now then this anterior division and posterior division form a cords. And with cords, we have posterior cord, a lateral cord, and medial cord. And then we have our peripheral nerves, right? So over here, rami, 5 ventral rami, C5, T1, trunks. So it's like, it's like rami is pretty much roots, right? Like a tree. So we have roots, then we have trunks, then we have divisions, and then we have cords. So trunks, we have upper, middle, and lower trunks. Then we have division, anterior and posterior, and then we have cords, lateral, medial, and posterior. And then we have peripheral nerves. So let's look at the next picture first to see anatomical picture of this nerve. Now, when you see what's shown here in green, that means these nerves come from posterior division, right? So axillary nerve and radial nerve. So they come from the posterior division, and everything shown here in yellow comes from anterior division. So let's go back over here. So you see our divisions, we have anterior division and posterior division. And then over here, they show in green our peripheral nerves now, because you see they go to your arm, to your fingers, to your arm, to your forearm, I'm sorry, to your fingers, right? So that's our peripheral nerves. And from posterior division, we have axillary nerve and we have radial nerve. From anterior division, we have, look, this is this bone is called the radius, right? That's this green one we call radial nerve. This bone is ulna. So this is ulna nerve. So here's the ulna. This is the radial. Between them, in the middle, we have median nerve. That's our median nerve. And this one is musculocutaneous. That doesn't go that low to, it doesn't innervate your forearm or your hand. Right, so again, let me get, pencil that does not disappear. So we have radial nerve, and it's on the radial side. We have ulnar nerve right there, right? And it's on the ulnar side because this bone is radius. This bone over here is ulna. So we have radial and ulna, and between them, right there, we have median nerve. Plus, we have axillary nerve that innervate, that goes towards the axillary region, and we'll see what they innervate in a second. And we have this musculocutaneous, oops, I'm sorry. That's why I use the one that disappears, musculocutaneous nerve, right? Hope it makes sense. But now let's see what they innervate. So axillary nerve innervate deltoid, teres minor, skin and joint capsule of the shoulder. So you can just remember at this point that innervate, shoulder muscles, right, including deltoid. Now, musculocutaneous innervate muscles of the arm anterior compartment. So bicep brachialis, coracobrachialis, skin of the lateral forearm. You know what? We're not gonna remember sensory branches because skin, that means that's our sensory branches mostly. So we're just gonna look at the motor branches, right? So allow it to move muscles. So musculocutaneous, look at your arm, right? Your brachial region, anterior part of brachial region, musculocutaneous. Axillary, your deltoid, teres minor, so your shoulders. Now, median, most flexors, and your flexors are on anterior compartment. So flexors of forearm and some intrinsic muscle of the hand. Ulnar, most muscles of your hand. So median, mostly your antebrachial region, and ulnar, mostly your hand. And radial innervates all the muscles of the posterior brachial and antebrachial region, right? All extensors, that's on the posterior side. So when you look over here then, right, you can see that musculocutaneous, where's my, so here's our muscular, didn't pick up my pen. Okay, so anyway, this is our musculocutaneous, and musculocutaneous gonna innervate these muscles, right, of the anterior compartment of brachial region of your arm, right? Now, this median, the median, gonna innervate most of the muscles of anterior compartment of forearm. Now, ulna gonna innervate lots of this intrinsic muscle of the hand. And radial, because it's a green, it's from posterior compartment, right? This is gonna innervate posterior muscles of the arm and forearm. In your lab, I think you also have more information about innervation here. Next one, lumbar plexus. So let's get to this picture first. And lumbar plexus, so over here we have from L1 to L5, right? So here's our plexus, And then we have our, you know, obviously peripheral nerves. And I think we only are gonna look at two peripheral nerves over here, obturator, that goes through this obturator foramen, and it's gonna innervate muscle of the medial compartment right there, right? And a femoral nerve. And femoral nerve, now this is often as you know, huge nerve over here, but it's a superficial nerve, so it's mostly sensory. But this femoral nerve, interesting, is gonna really innervate. Oops, I'm sorry. See, so this obturator innervated, remember this medial compartment, and femoral gonna innervate this anterior compartment of the thigh, and it does not go to the leg. For a leg, we have different nerves. So let's see over here. So we have femoral nerve, innervate quadriceps and skin of the anterior thigh. Obturator nerve passes through obturator foramen and innervates adductor muscles, and adductors, they are in medial side, right? They also innervate some abdominal wall muscles, arise from L1 to L4. Okay, next, a sacral plexus. So sacral plexus L4, S4. So you can see it's in a, shown here in the posterior view. So here's our sacral plexus. I'll pick up my pen. Right, so here's the sacral plexus, and it's formed the biggest nerve of your body, sciatic nerve. So you can find your sciatic on the posterior side, and sciatic is actually two nerves together. It's a tibial nerve and common fibular nerve, right? So we call it sciatic, but this is two nerves running next to each other, and when they approaching this popliteal region, right, it's a posterior side of a knee, it's a splits, and it splits into this tibial nerve, because this bone is tibia, so this tibial nerve, and then common fibular nerve, and then common fibular then became deep fibular, right, and superficial fibular. So now, so here, sciatic nerve, longest and thickest nerve of the body, innervates a hamstring muscles, adductor muscle, most muscle in a leg and foot, and composed of two nerves, tibial and common fibular. So sciatic nerve is actually the one that gonna innervate, the muscle of the posterior thigh and anterior and posterior leg. Right. So that's our sciatic nerve, and it's arise from the sacral plexus. Right. So let me see where we at. I think that's the last slide. So very quickly about these plexuses. So we have cervical plexus in the cervical region. Phrenic nerve is important one. Brachial plexus. Now, the nerves that are formed from brachial plexus gonna innervate your upper limbs, so your arm and forearm and hand. Then we have lumbar plexus, and we have sacral plexus, and nerves from these plexuses gonna innervate your thigh, right? Sacral gonna innervate your posterior thigh and leg. Right. Okay, so that's it for this video lecture. I will have one more lecture to record. That will be physiology part of central and peripheral nervous system. But anyways, thank you so much for watching, and I hope it was helpful.